I'm Dr. Owen Johnston, and I'm the co-founder and owner of Advanced Physical Therapy and Wellness with my wife, Dr. Jen. And I want to share with you guys a little story about how I got fired from Kaiser and then took that situation, overcame the obstacle, and created a multi-six-figure physical therapy practice in just a few short months. And I love it. If you like what I share in this video, make sure you hit the like and subscribe button, as well as share it with other people that may be interested so that you can be notified when we drop other videos. So what I thought about being a PT would look like when I was in PT school, like what I envisioned it. I envisioned working with people one-on-one all day, every day, and getting people better, getting results. However, when I got into the field, it was drastically different than I had thought. Um, it turned out that I was, rather than seeing one person at a time, helping them get better, I was seeing 20 to 30 patients a day and only getting to spend about 5 to 10 minutes with each individual patient. And I feel like we weren't getting the results that we are now. So what I experienced when I got into a traditional clinic, I suppose what a day in the life would look like. I would go hit the gym at like 4 o'clock in the morning. I would exercise to get it out of the way or do it on my lunch break. I would immediately drive to work. I'd get there 2 hours early so that I could get caught up on the notes and the paperwork that I had from the patients the previous day, because even with working through my lunches, I was still not able to complete all my documentation. So every day, about 5 days a week, I would need to spend an extra 2 hours of my time just doing paperwork. Um, Aside from that, I was being paid salary, so I wasn't even being necessarily reimbursed for the amount of time that it took. My schedule was jam-packed with 4 patients an hour usually, so I felt like I was still working at Domino's Pizza like I had during college, kind of running around with chicken with my head cut off, delegating all these tasks and like throwing patients in a conveyor belt pizza oven sort of a thing. And then and I was frustrated that the patients were not all getting better. And some of the thoughts that I was having was, this is my dream job. If it just weren't for the paperwork, this is my dream job. And then I came to quickly realize that a dream job you don't have to make excuses for. You don't have to mentally condition yourself that you like it. It already has all the things that you know, like, and love. Also, too, even when I worked at Domino's Pizza, we didn't have to work like that. We didn't have to work like that all day, all shift. That was during rush hour. That was from like 5 to 7 p.m. This was all day. And I was like, so this is going to be the rest of my life? And I was like, I don't think so. Okay, so what I did was, after about 2 years, I got burnt out in the outpatient setting, and I was looking kind of for a psychological break, I guess you could say. And I'd heard that home health PTs, they only saw a handful of patients a day, and they made a lot more money than outpatient physical therapists. Even though my passion lied with doing hands-on manual therapy and like getting athletes back on the field, or like getting the spouse like able to walk on the beach at sunset with her husband again, just goals like that, it changed to getting into home health. Now I did get the pay increase. I started making about 40% more, a huge pay increase. And also too, the psychological break of only having to see 2 to 5 patients a day, which was pretty awesome. But it was not necessarily what I was passionate about doing either. In that, I was kind of helping people in kind of more the geriatric setting, as far as like helping the patients and teaching the caregivers how to assist the patient with like that mobility, kind of rolling over in bed, sitting up in bed, basic transfers, bed to chair, shower transfers, car transfers, and then how to use like basic kind of functional mobility assistive devices like walkers, canes, crutches, and all that kind of stuff. I did not use, I didn't, it was not necessary to have the skills of the manual therapy to get kind of like maximize performance in those settings. And also too, I worked for a company, I worked for Kaiser, and for about 4 years, and it was great. I'll admit, a lot of us in Kaiser was like, we all said the same thing. We loved working for Kaiser. It was awesome. Unfortunately, or I guess fortunately and unfortunately, they call it the golden handcuffs. So they call Kaiser the golden handcuffs because basically you're kind of locked in, you're stuck, and they pay just above what everyone else appears to be acceptable in terms of pay, benefits, your continuing education, being able to travel and therefore take time off. And but however, they do kind of redline you a little bit, so that you're kind of almost pulling your hair out and stress from being micromanaged. So that's what they call it, the whole golden handcuffs. So it's like the glorious imprisonment. So while being comfortably uncomfortable, I didn't really realize that I was doing this, but I was actually subconsciously creating the steps without even myself being aware of it in order to create that dream job as a PT that I had when I was in school. Like I said, Kaiser had a very generous continuing education budget. So, and that budget was $3,000 a year. And so I used all of it. I used all of it on all the skills that I wanted to learn, what I was passionate about and was interested in, and that was manual therapy, hands-on corrective exercises, all the things that I knew in my heart were going to make 1,000% difference in my patients' lives. However, I wasn't necessarily required to use them in home health. So there was almost like this juxtaposition. I was like, why am I taking these classes? And it's like, well, apparently it was for my future, to grow my career as a physical therapist. But I did keep the arrow sharpened. I did use all of the skills that I had learned on my friends, my family, athletes, and didn't charge anything. Just wanted to get feedback, and I got all of them better. And it was phenomenal. It was way more gratifying than going to patients' homes, which I kind of was mentally conditioning myself, tell myself that I liked doing because I was comfortable, but I was also uncomfortable too. Was that I was programming myself that I was still making a difference in people's lives. And I was, making the right call, getting a social worker in there when someone was in danger, or calling a nurse when there was like a wound that looked like it was getting an infection, stuff like that. So I did help people, but it just wasn't along the lines that I was passionate about. So interestingly enough, at that time, when I was subconsciously doing this stuff, there was a greater power above myself, aka God, and I was doing a lot of deep inner work. So I was doing a lot of prayer, a lot of meditation, and I was being told that I was not following my path. I was not doing what I was put here on this earth to do, what I was created for, and I was not hanging out with the right people and forming the right relationships. And I was just like, I thought it was some sort of like intrusive thought, like that just kept popping into my head whenever I was praying or meditating. And I was just like, I would shake it off and be like, no, God, that's not God. That's just an intrusive thought. And I am comfortable. I have great relationships. All of my friends in my life decrease anxiety, and a reduction in anxiety is researched to be a correlation to happiness. Therefore, my friends make me happy, and I get paid better than any other PT that is employed in any field. And I have the best benefits, and I have the best vacation, I have the best everything. So how could I possibly be not being what I'm put here on earth to do? I'm doing it. And then so I stopped paying attention. And then I basically just got a kick in the butt, like out of the nest. Like, oh, how do you take the handcuffs off? How do you take the golden handcuffs off? Well, the jailer takes the handcuffs off you and releases you. And that's what happened to me with Kaiser. So if you want to hear more, like I said, like, subscribe, share, because it's going to be on the next video that we're going to be dropping next week.